Hello and welcome to this edition of Central Connecticut Now, the program that brings you closer to the people that make the news and the people that cover them. I'm Mike Schroeder, publisher of the New Britain Herald and Bristol Press, and this special edition of Central Connecticut Now is going to be via Skype in an empty studio with a couple of very, very good technical folks that are going to make this happen. We're going to be talking with Congressman John Larson of the 1st District of the U.S. Congress in Connecticut here, representing Hartford and the greater Hartford area. And we're going to be talking about the pandemic that's going on right now and what's going on in Washington to help get us through it. Well, Congressman Larson, welcome to Central Connecticut Now. I know it's been a busy time for you. It's been a crazy time for us. And we've all got plenty to do. But we wanted to get in touch with you to find out, how do you think things are going in Washington with all of this, all of the decisions that have had to be made, all the programs that have had to be implemented on the fly? How do you rate things?
Well, you're breaking up a little bit, but
okay.
I think the question was, how do we rate things that are going on in Washington, D.C. currently?
Yes.
And, well, I think Washington was slow to react initially, but I do think that since early March, having passed 3 packages, and most notably the last package that was passed on March the 28th, to pass a $2 trillion package in 5 days is quite a feat. Mm-hmm. But that at least showed that people were starting to understand the gravity of this situation and making sure that we got the money out the door and where it was needed. You got to give Governor Lamont a tremendous amount of credit for having recognized early on what needed to be done and taking decisive action. I think President Trump and the administration were somewhat in denial initially and equating this to nothing more than the flu. But to their credit, they've come around and now are, hitting this head on. And I think this is a time, Michael, when everybody's got to all pull together, where you have to recognize that this disease doesn't distinguish between Democrat or Republican or independent. This is something that's a global pandemic, and we better respond in the right way. And by that I mean focusing on the health concern first, because everything else, as important as the economy is, and as important as it is that we get it started up, if we go back prematurely, if we don't take all the appropriate steps, both in terms of making sure that our frontline heroes, by that I mean our doctors, our nurses, our healthcare providers, EMTs, the police officers, those grocery clerks and truck drivers, and all those individuals that are out there doing their job while we, as is appropriate, social distance, but also heed the governor's admonition that we stay at home, stay safe, and stay secure. And so now Washington's we're going to need more money, because we've already seen that first batch was not enough money, especially, again, as it relates to making sure we get this right from the health standpoint. It won't matter if people go back to work, got this. That will only further exacerbate the problem that this virus has presented to us, and especially the way it presents itself.
Do you expect the next round to go through more smoothly than this one? The next round.
We hope that the next round will. Yes, we expect that to go through. You may recall that last weekend McConnell had proposed additional money, but he didn't propose additional money for the first responders, for the hospital care, et cetera. And so we think it's a little bit of the cart before the horse. You got to make sure that those people that need our protection that are in short supply, and especially the gear that they need, whether it's gowns or masks or whether it's gloves or whether it's, more importantly, ventilators. It's why I called early on for the president to initiate defense production, wartime defense production, so that we could get ventilators out, but also gives him broader latitude to call upon companies, not without just compensation, but to get them to do the bidding of the country as though we're in a war. And in fact, we are. It just happens to be a silent war with a virus that you really can't see, but every bit as dangerous as any enemy we've ever come up against.
Do you think that we've implemented that wartime face at this point adequately?
I think that I think he needs to be more specific. He's issued some parts of it, but he's held back on others, and he's relying a little bit too much on the private sector, which is commendable that they're involved. But if we're waiting for supply and demand to catch during a crisis, it may not.
Yes.
And so what we need to do is to make sure, and I think during the Great Depression, Francis Perkins advised Franklin Delano Roosevelt the following: not only must we deal with the immediate crisis, but to make sure, especially given the nature of this virus, that we're not only dealing in the immediacy of what this virus presents, but as we come up with a cure, that we're just not throwing money at the situation, but that after the crisis has subsided, we will be in a better position to prevent the next one from coming. And so I think that's where both the president and the Congress need to keep their focus.
It seems that the long-term solution to this problem is the vaccine.
There's no question about that. And the long-term solution is a vaccine. Normally, a vaccine of this nature may take 3 to 4 years, maybe even 5 years. Now, they're confident that they can get it out between the next 12 to 18 months, and they keep pushing it back a little. So they were saying that in March. It's now April, and they're still saying 18 months. And in the meantime, also hopefully coming up with some remedies that may, depending upon your given health status, and by that I mean there are some people that are more susceptible, some people whose immune systems react different than others, some whose immune systems have been compromised, like cancer survivors or heart patients, and et cetera. Those are the people that we want to make sure that we are extra cautious with, and that we're making sure that we get this right. But they're working overtime, and anytime this nation puts its mind to it, we're a great country. We have great scientists. We have the best resources, the best universities. Let's all put our shoulder to the wheel and get this done. We could put a man on the moon. We can certainly conquer coronavirus.
Sure. Now, have you gotten any calls from any of the hospitals in the state to assist them?
I've actually been in touch with every hospital in the 1st Congressional District and talked to others. Well, Jeff Flax from Harvard has 21 hospitals across the state, et cetera, but also talking to Bristol Hospital as well, and understanding, their needs are the same as anywhere else. Their primary concern is that the frontline individuals make sure that they have the gowns, the gloves, the masks, and of course the ventilators that are going to be needed, and expansive efforts that are going on with respect to creating beds. And I have to commend a number of our universities in the area as well, and who have been stepping up, and people who want to help in any way that they can. We've put Hartford Hospital, which is the largest in the region, in touch with FEMA in terms of getting a field hospital here in the greater Hartford area as needed. But they've already gone about that. And again, when you're bookended, as Connecticut is, between New York and Boston, both who are at the height of the disease, and hopefully this week we see that starting to subside, which means that in Connecticut, it could be probably within the next 1 to 2 weeks that we also see this start to come down, and that is the hope.
Now, do you believe that in the next round of legislation there'll be aid for hospitals, financial aid?
Yes. Well, there was $100 billion, and still that's FEMA and the health officials have been slow to get that money out the door, and they're already going to need more than that. And in a fourth package, and even in this business package that's going out, I can't reiterate enough, it does no good to get the business back if you don't take care of the healthcare situation. And we have too many of those frontline people who are now sick themselves because they've been exposed on a regular basis. So both in terms of recruitment, volunteerism, waivers where it's appropriate and needed to make sure that we get the healthcare officials there, but most importantly, making sure that they've got the ventilators, the masks, the gowns, the gloves, everything they need to protect themselves in these situations.
It is a difficult deal to see that healthcare providers are being hit the hardest of any group that is being fallen by the virus. Do you? And we could just see. I could see this just as a 9/11 situation starting all over again, where they are hurt now and they're going to be hurt well into the future. Are we taking is there any kind of lookout for the future, especially with the limited safety?
Most assuredly, and there's a number of questions, of course, are always raised. And to your point, and I think it's a very good one, go back to September the 11th and all of the concerns back then about the possible threat from, in this case, terrorists from the outside. But we've survived other pandemics, including the Ebola crisis as well, and also including an economic shutdown as well after the great crash of 2008, 2009. So there has been ample warning. But to your point, oftentimes after the crisis passes, there's a tendency to forget and to move on without addressing this issue. So I think this is a wake-up call. Good news and bad news. The good news is that we have the capability, the science, and the knowledge to be able to address it. The bad news is that we've been slow and behind the curve and haven't reacted in the way that we need to do so. And so we're going to have to play catch up. And to your point, especially for these people on the front lines. And again, it's well worth repeating that these are the heroes of this and heroines of this crisis are the doctors, the nurses, the healthcare providers, the people at senior centers and nursing homes, and so many people who are isolated, and our hearts go out to all those people who can't visit or even see people who have contracted the virus, who are rightfully in isolation. And we hear of case after case, sadly, of people who couldn't be with their loved one when they passed because of the nature and concern about the spread of this virus. And knowing how to react to this and reacting in a timely fashion, and all the science continues to point to the fact that isolation, social distancing is probably the best way to prevent this disease's spread while we work on the vaccine and while we also work on antibodies or other remedies that may help ease people through this. And the more we learn about COVID-19 and its varying degrees, there are some you could test positive for COVID-19 and yet you may not be contagious.
Right.
You could also not test positive and still be carrying the disease. So the absolute critical thing here is more testing. And the way I think we're going to be able to get people back to work and get the economy going again is for there to be constant testing so that people know. And I'm told that the technology exists to do ample testing and thermometer testing by mouth in a way that will lead you pretty safely to understand and know that you don't have the virus, and so therefore we're not likely to spread it.
Well, there's also the secondary health issues like depression, suicide, domestic violence, that are all secondary to the main cause, but all are things that need to be addressed. Are those? Do you think those are going to be adequately addressed?
Well, I'm not sure that any disease is ever adequately addressed, but that is the most thoughtful question, because yes, and it also deals with, and the president's not wrong about this, that we have to at some point get the economy back going also, because that always also carries with it all the secondary reactions that you just reviewed, the suicides, the depression, the anxiety, the going into bad habits, and whether it's drug addiction or alcohol addiction, et cetera. These in times when people get depressed, and especially in times of isolation, this is when we really need, and you hear anecdotally the incredible stories of people doing everything that they can to both cheer on our heroes and make sure that they're taken care of, but also reach out to people that are isolated, and the dropping of food off at their doorsteps, and the tremendous efforts that are going on in communities. That's what we're going to have to continue to need as we get through this. And then I think a long dialogue into the future, and there hasn't been enough discussion as well as about how some, and usually the poorest amongst us, are impacted more harshly than others.
Yes.
The poorest amongst us are also more susceptible to disease. Why? Because they don't usually have the best nutrition. They don't have the regular hospital or doctor visits as everyone else. And again, let me give Governor Lamont a tremendous nod here. Getting that 211 line, and anyone who listens to this program, that's probably the most important thing. And we've done now, I'll be doing another town hall with Senator Murphy at 4:30 today, but these town halls, we give out that number all the time, and I can't tell you how many calls we've received back from individuals thanking us, because if you don't have a doctor, if you don't have insurance, you can still get tested, and you don't have to pay. That Congress passed in the first bill that we passed, made sure that anyone, whether you feel like, well, will my copay cover it? Do not worry about it. Get the test, because that's the most important thing. It'll give you peace of mind. And if you do test positive, it'll give you the directions and what to do, where to go, and whom to see, even if you don't have a doctor.
Well, are we still at the point where we're conserving tests, where it's rationing?
Well, they are. We're told that we're on the verge of breaking through this, but they still are saying, and that's the conundrum, Michael. I mean, we really should be doing more testing, and then even as you're healthy and people get back to work, you're going to want the reassurance that there's no bounce back, or as next fall comes and we still don't have a vaccine, and you get revisited in a normal flu season with COVID-19, or the coronavirus as it's commonly referred to, are we going to be ready, and will we have the testing available so that people can feel confident employers and employees can make the decisions that they have to make based on that.
Well, I think most of the scientific community agrees that testing is the most important part of a solution to this problem, and yet we don't have the test to test. It is, as you say, a conundrum. How do you make people get a test they can't get?
And we need, again, I think, defense production like attitude on the part of the federal government to say, and the president can do this through executive order, to get those out. You hear from various people that what we need, we average about 50,000 tests a day. We need about 20 million. So we're a far cry from where we need to be. We've improved greatly, and they say it's getting better all the time, but you also need that distribution network so that it gets out there. And obviously, some areas of the country that are more densely populated than others, and we're in that perfect spot, bookended between New York and Boston, where in Connecticut we need testing badly, as they do throughout the whole Northeast.
As you look at the situation right now, where are you in your planning timeline? How long do you think this is going to go on before there's the first cracks of an opening to a semblance of normalcy?
Well, I think the best advice here is to listen to the scientists. You've got to let the scientists lead. I'd like to say that I'm a scientist. I'm more of a social scientist and old history teacher, but you have to learn from history. And if one thing I know about history is that we ought to let the scientists, the doctors, and the healthcare professionals lead the way with respect to this. Arm them with the equipment and resources that they need, including making sure that our national labs get the extra money that they need to do the kind of testing and maybe move along and hurry up remedies and or vaccines, etc. So what I'm going to do as a elected official is rely on what the scientists and healthcare professionals are telling me. I know what the business community is telling me. They're saying, get us back to work as soon as possible. And I don't disagree with that, but I think even they are understanding, and especially the more that people experience in their own lives what's happening to people. And if you visit a hospital or listening to these healthcare workers talk about what they're going through, or somebody who has a family member that's experiencing this, it can be a very jarring and frightening time. So all the more reason to adhere to the science. We will develop a vaccine, and if we practice, the social distancing and heed the advice, we'll minimize the impact that this is going to have.
Thank you so much, Congressman Larson. You've really got us up to date on what's going on with this tremendous pandemic in our area. And hopefully we'll get back to you and be able to talk to you about something way down the future, Social Security, the next time you're on.
Well, that's a key part of this, though, because that is the most vulnerable part of our generation. And also in terms of the disease, its impact hurts the elderly the most because their immune systems are the most compromised. And we haven't improved Social Security, as you know, and we've had this discussion before. The last time it was enhanced was more than 50 years ago, and it's been 37 years since we've made it sustainably solvent.
Well, we'll be able to get back to that on a whole separate show, but I've got to let you go. I know you have a meeting at 4 o'clock, another town hall. Get out the good word. We all want to tell everybody to play it safe.
That's exactly right.
Thank you for joining us from your office in Hartford.
Thank you.
Take care.
My pleasure.
Thank you very much for joining us this week on Central Connecticut Now.